Thanks for being here for the daily update. We have 4,448 cases of coronavirus in Victoria. That's an increase in new cases of 238. Of those 238, 29 related to known and contained outbreaks. 209 of those are under investigation by our public health team. There have been a total of 27 deaths, I'm sad to have to report, following the Chief Health Officer's media release yesterday. There's been a further death since then, a woman in her 90s. I'm not in a position to be able to provide any further detail as to that person's identity, but we send our best wishes, our thoughts and our prayers to her family. This will of course be a very difficult time for them. So that's 27 in total, one more since the Chief Health Officer's media release yesterday. There are 105 Victorians in hospital, 27 of those are in intensive care. There are 1,931 active cases across Victoria. There were yesterday some 27,040 tests done. That is a really significant number given that so much of the state is under stay-at-home orders. So that of course limits movement. That of course for some might be a barrier. It shouldn't be really, but for some it might be a barrier to going and getting tested. Can I thank each and every one of those 27,040 people who yesterday made a powerful contribution to our fight against this virus, coming forward, getting tested, giving us the data, the insight, the understanding about where this virus is, how it's moving. Without that data, it's incredibly difficult to be able to contain this virus, to pull it up, to get it into a controlled situation. It's very, very important that people keep coming forward and getting tested. We've got more than 150 test sites across the state. It's a relatively simple and quick process, and one that does make a really big difference to obviously knowing where those cases are, determining who their close contacts are, chasing them, locking them down for that period until they get tested, or indeed for the 14-day period, whichever is the advice provided. It's logical, but it's really powerful, really, really powerful for all of us to get a hold of this thing. Can I just give you the total number? That means 1,197,392. So the best part of 1.2 million tests have been conducted since January 1, and our testing rate per 100,000 people remains one of the highest in the world. So that's the daily update. They are all the figures. In terms of broader messages and advice to Victorians, this is very, very serious. We haven't got these stay-at-home restrictions in place for any other reason than they are the best medical advice to try and bring some stability and then a sense of control to this global pandemic as it presents here in our state. The vast majority of people are doing the right thing, and I'm very grateful to each and every one of them. They, by doing the right thing, are making a really complex and challenging task just a little bit easier. So I would continue to call upon all of those Victorians who are obeying the rules, making sacrifices large and small, know and understand that you not only have our gratitude, but you are central to this strategy working and us having a lockdown that doesn't run any longer than it needs to. If, however, people do not do the right thing, then we will have to move to additional restrictions being put in place, and we will have to potentially prolong the period where those restrictions are in place. Nobody wants that. No one wants a situation where, because of the choices of a few, the vast majority of Victorians have to endure these very frustrating and challenging restrictions any longer than they should. So again, thank you so much to every Victorian who is doing the right thing. It's something that makes you very proud. I'm very grateful, and I just want to be really clear though that anyone who's not doing the right thing, Victoria Police are out in force. Deputy Commissioner Rick Nugent has joined me today, as well as Police Minister Neville. Lisa will speak next in broad terms about enforcement activity, and then Rick's more than happy to speak to you about some of the pretty poor choices that they have uncovered, and they will continue to do that work. Not only is it the wrong thing to do, it's just not a very smart thing to do. Victoria Police are out there with a very clear agenda, and that is to make sure that these stay-at-home orders work through a very high degree of compliance, The time for warnings, the time for cutting people slack is over. Where we are is in a very serious and deadly position. These hospitalisation numbers are a great concern to us. We have always been very clear that unless we all pulled together, did the right thing, worked to support each other, then families would be affected, communities would be affected, indeed our entire state would be impacted. We are confident that our dedicated nurses, doctors, all the health team have the resources and the resolve, the skill, the care, the compassion that they need to provide care and support to those who are gravely ill. But let's not leave it to the last line of defence, our health workers. Let's instead appreciate and understand and, frustratingly, embrace the fact that we are the front line. Every family, every Victorian doing the right thing is a massive contribution to us getting on top of this and being able to then again resume a process of easing the restrictions that I know are challenging. I know they're difficult. No one is enjoying this. But the alternative, well, there really isn't one. This is the only way forward. It is based on the best of medical advice and it will work if everybody works with me and my team, a team that is thousands big, but even a team that big can't do it on its own. Every single Victorian has to play their part. And again, let me make it really clear, I'm so grateful and impressed and proud of all of those Victorians who are doing the right thing. And you see it in the traffic data, you see it in, as you move around the city, spaces that would normally be quite crowded are not. And that's exactly the outcome that we want to see for these next 5 or so weeks. I might now throw to... I might go to Deputy Commissioner Nugent to take us through some examples of some pretty poor behaviour that we've seen across the state and the enforcement activity that the Victoria Police have brought to bear on that. Rick.
Thank you, Premier. I might first touch on the vehicle checkpoints that we have operating across 8 sites around Metro Melbourne and that interface with the regional rural areas. So we currently have the 8 vehicle checkpoints that are operating well now. And firstly, I would also like to thank the community for being understanding. This is not a role we've undertaken before, so it's been, we are most thankful for the support of the community and their understanding and their patience. We know that particularly down along Geelong Road, it was a little bit challenging on Monday with some of the traffic. It's a large volume of traffic heading down there and we're trying to get the balance right of checking as many vehicles as we can to ensure they are complying, at the same time ensuring that there's the traffic flow. So I just wanted to thank the community for that. Since we commenced at midnight last Wednesday with these restrictions, we've checked 85,000 or in excess of 85,000 vehicles at these checkpoints, the majority of whom are complying with the restrictions. We are still finding that others aren't. We've issued since then 151 infringement notices to people who are not complying with the restrictions. The most common reason is going to visit family and friends or associates and overnight stays, so that is clearly not permitted under the Chief Health Officer directions and will continue to enforce that. More broadly, Operation Sentinel continues to operate across the state with police checking private premises to ensure that people are complying where they need to, checking populated areas and checking businesses. Since midnight last Wednesday, we've issued an additional 351 infringement notices for those people breaching the restrictions. Some examples of that: last Thursday night in Latrobe Street, Melbourne, there was a party at a short-term rental property. Police were called due to the noise, issued 10 infringements and moved the people on. They were called back to that premises some hours later, and another 24 infringement notices which were issued to people who are breaching the restrictions and holding a party there. And this morning, the owner of that short-term rental was issued with a penalty notice and infringement notice for permitting that to occur, leasing out that property for that purpose. Additional examples of people breaching includes not leaving a restaurant when asked to. So clearly KFC is popular during the lockdown. A person ordered KFC and sat in the restaurant and refused to leave. Police attended and the person still refused to leave, wanting to finish their KFC. They were also issued with an infringement notice. And then last night, 10 mates sitting together around a heater, consuming alcohol, clearly a breach of the restrictions out on the street, and they were also issued with infringement notices. The reasons for leaving your premises are well known. I can say they don't include playing Pokemon. A couple of mates out in the car travelling around playing Pokemon doesn't fit within those reasons to leave, and those males were issued with infringement notices. As is visiting massage parlours and massage businesses or undertaking sex work. Since the restrictions have commenced, we've issued over 40 infringement notices to individuals visiting those premises, and additionally 2 business infringements have been issued, so over $10,000 fines to those premises as well. So we ask, please, to the community, abide by the restrictions, support the work that's being done to address this health emergency. As has been said a number of times now, the time for discretion is over. Any blatant, deliberate breach of the restrictions will result in an infringement notice being issued. A particular concern for us is the ongoing parties and gatherings. People playing poker, people holding parties. We're finding people in cupboards, we're finding people in garages. Please stop, do all you can to support what the rest of the community is doing to address this health emergency. Thank you very much.
And the clear message is that, not only shouldn't this be happening, but if it does, Victoria Police are out in force, and the time for warnings is over. Last time there were many more warnings issued than fines issued. This is different. People know and understand the rules. There'll always be there'll be common sense and fairness to it. Sometimes things are not quite as clear cut as they might seem, but that's the rare example. None of the examples that Deputy Commissioner Nugent has just cited are anything other than blatant breaches. And we all know that we'd like to be spending time with family and friends. We all like to know. We all know that we'd like to be in a normal winter. This is not normal. COVID normal is what we have to find, and following the rules is an essential part of that. Behaving like that just means the restrictions will be in, potentially tougher restrictions, and they'll be in for longer than they otherwise should be. Again, thank you so much to all of those who are doing the right thing. They're making a powerful difference, particularly those who are coming forward even with very mild symptoms and getting tested. But to the minority of people who are still making very selfish choices, not only is it the wrong thing to do, it's just not very smart, because Victoria Police are out there in force and they are not mucking about. I might now ask Brett just to speak to the epidemiology of the day, and then we'll take any questions you've got.
Thank you, Premier. So with 238 new cases today, we are seeing just a little bit of stabilisation in numbers over the last few days, but it's still a significant number. As I've said yesterday, a proportion of all new cases will develop severe illness. They'll need to be hospitalised. A few percent of those totals will require intensive care, and 1 in 100 or more die. So when we have 238 cases every day, we're looking at 2 to 3 deaths in a week or more's time. So we have to have these numbers decrease. But the stabilisation of the last couple of days might be just the very beginning of the effect of the restrictions that have been put in place now for a week or a bit more. So it's somewhat encouraging, but it's absolutely not enough, and we need to make sure that we can drive these cases right down by sticking to the rules and by doing everything that we can to manage our own symptoms, so isolating whenever unwell with the mildest of illness, getting tested and making sure that we are limiting our contact with other people by staying at home.
Given the incubation period is about a week, when do you think we will see a drop-off given the lockdown is 6 days old?
There's no guarantee in a drop-off. We should see it by the end of this week. but it absolutely will be a reflection of how well people are doing the right thing in the week past. That means that if there are people who are still seeing others, who are going out for non-essential reasons, who are exposing others because they've got symptoms and they're not isolating, we won't see it decrease. We'll see it carry on like this with the potential for outbreaks and explosive increase in cases. So I would hope that it's turning the corner this week, but no guarantees.
We saw 26 new cases in Brimbank and 24 new cases, or a net increase of 24 in June yesterday. Those two LGAs had lockdowns. They were part of the original post-COVID lockdowns. Does that show that those lockdowns haven't worked, and how concerning is that?
Yeah, I don't know that it means the lockdowns haven't worked. It means that they were always our hotspots. There was a lot of community transmission there. There are more opportunities for people to be exposed. I guess it highlights for me the real need for people to have an awareness of symptoms, especially in those high transmission areas, to absolutely follow the rules in those areas and to be aware of the testing that's available there. It also means that if you're going out in the community for those essential reasons, there's more risk of transmission because of the higher number of cases there. So mask wearing becomes one of those critical things, hand hygiene, and making sure that you limit the number of people who have to go out for essential reasons, including shopping for food, including shopping for essential services. If one person in the household can do that, that's an absolute benefit.
Do you have a deadline of when you'd like the numbers drop down before taking stage 4 off the table?
No single number goes into any of these decisions. They're all about reviewing the epidemiology in full on a daily basis. It does depend where we're seeing the transmission occurring and where we need to focus our attention. Again, if it's a matter of a failure of compliance, we know that awareness raising and communication and enforcement activities need to play a role. But if it's around other issues, then we need to address those through whatever mechanisms might be available, including a step up of restrictions if required.
How likely is that, either that we extend the restrictions throughout the state or that we go deeper?
I don't know. I honestly don't know how likely it is to step up or the opportunities to step down. But we've set that 6-week period because I'm very confident that that's the length of time that will actually be required to drive cases down. But in terms of stepping up, it really is in everyone's hands, and it's hard to say exactly how things will go in coming days. This is a wave that is different to the first wave. Returning travellers, smaller families, fewer number of contacts, easier to identify, more likely to be engaged in testing because they could identify themselves as being at risk, either as close contacts of an international traveller or someone who had travelled internationally. This wave is trickier, and so it won't be as easy to drive numbers down with the community transmission that's out there.
I realise that you can't give us any information that might identify anyone, but in terms of the 5 people we've had die over the last 2 days, are you able to say how long they'd had the illness at the point at which it became fatal?
I actually don't know, Rachel. The usual course of the illness is that it can be mild in the first few days, that there is often a deterioration around the 1 week mark. There are some people who can actually have symptoms improve for a little bit before deteriorating again, but it's in that 2nd week generally for people that there's a significant deterioration in their clinical state. That's why I made the point yesterday about early referral to tertiary care if somebody is deteriorating, or if anyone, family members, GPs, primary carers are concerned about someone's clinical status, because getting that early intervention, whether it's dexamethasone or remdesivir or one of the other therapeutic agents that might be available, and getting people into hospital earlier will improve those outcomes. And I think you've seen today Australia has one of the best ICU survival rates in the world. In part that is because of the excellent standard of care, but it's also because we haven't overwhelmed our ICUs with thousands of new cases a day. That's one of the reasons why having the lowest conceivable numbers that we can get to means that we can provide the very best care.
Has there been any new clusters or any significant increase in the existing clusters in the world?
Look, a couple of clusters to note. 9 cases in Bracia Aged Care in Moonee Valley, so another aged care home. There are 2 cases linked to St Basil's Home for the Aged in Fawkner. There are now 21 cases linked to JBS Abattoir in Brooklyn, again closed for some time now. There are 5 cases linked to steel mains in Somerton, and 4 cases linked to waste equipment and HIAB services in Ardea, and 4 cases linked to TD cabinets in Dandenong South. So more workplaces, more aged care that we are totally focused on. We know it's a risk setting, and we know that people are largely bringing virus in, probably unawares, as staff members. So they need to have an absolute focus on the very, very first mild symptoms to exclude themselves from those settings, including thinking about whether there's illness in their family prior to them having any symptoms at all. Get your family members tested if you're a staff member who's going to a healthcare setting or an aged care setting, because that might be the first flag that you have that there's coronavirus in your household.
How many cases has the COVID app identified that haven't been identified through manual tracing?
Yeah, I'm not aware of any. Again, I will keep pushing the COVIDSafe app. There are over 300 people who've had it downloaded, who we've followed up as cases. But as I've emphasised many times, we're in policy settings in Victoria where people are just at home with their immediate family, and so the close contacts that they have will be those family members, and will be the workplace close contacts because they have to go to work. They are not going to large gatherings, they are not going to stand next to strangers for 15 minutes or more, and so the COVIDSafe app is not going to flag those interactions, because I don't think those interactions are largely happening.
But this year at all, that no one's been identified, that hasn't already been identified so the app's done nothing.
The app has not added a close contact that we haven't found through our, very extensive long-form interview that takes an hour or more, where we go through every single setting and encounter that people have.
So the PM said 300, so he's wrong.
In terms of additional contacts found, I can't speak for other jurisdictions, but 300 is the number of people who've downloaded the app who are cases in Victoria.
Were there any cases in schools since this year's students have gone back?
No, I'm not.
What new restrictions would we see under a stage 4 lockdown?
I think any consideration about what stage 4 might look like if it were to be in place is again based on the epidemiology. And so if we're seeing a focus in a particular setting, in a particular cohort of people, related to particular activities, that would be the focus of a stage 4 restriction.
Is there any chance that bottleshops would be closed?
Oh, look, I think bad news for some, I'm sure. Look, I think it would absolutely depend on the epidemiology. There's nothing that's guaranteed one way or the other in terms of what stays open or what closes. We just need to see where transmission's occurring and get on top of it by virtue of what we're seeing out of the data.
Just in terms of the masks, you've obviously made...
Sorry.
Just in terms of the masks, you've obviously made recommendations for people to wear them, but when you look at public transport, it's clear that a large majority are actually not obeying the recommendations. Would you like to move to mandatory mask wearing if that continues?
I think, again, mandatory mask wearing shouldn't be off the table. I'm cognisant that not everyone can buy a cloth mask, or the 3 cloth masks that we should probably all have to be able to manage cleaning them overnight and wearing a new one the next day. But it's a risk not to have them, especially with the level of transmission that's happening in Melbourne. So I absolutely urge people to be wearing them. I think the norms are shifting. I've certainly seen many, many more masks than in previous weeks, so that's a good thing. And I think we can do better. And people who may not easily have access to it, I wouldn't like to see an enforcement model where people are unfairly penalised when they can't actually access one yet.
Should teachers be wearing them in classrooms?
I don't think teachers should be wearing them. No, I've said it before. It's difficult from a teaching point of view. You need to see facial expressions. You need to understand the intent. You need to be able to hear and follow classroom teaching. For their social interactions within the school, going to and from school, for students or for teachers, they should absolutely consider masks, and I'd encourage them to do so.
Are the government providing all schools masks, but teachers don't want to wear them?
No, I don't believe they are.
On abattoirs, have any processes been changed since the Cedar Meats outbreak? Got a boss of a Laverton North facility complaining that his worker tested positive, and then it took a number of days for him to be asked by authorities where he worked.
I'm aware of that case. I've been made aware of it this morning. My understanding is the department was notified close to 11 p.m. on the 8th, and we responded to that that facility and spoke to the chairman there on the 9th. So there's been immediate follow-up. There are more detailed interviews that can happen subsequently in the next 24, 36 hours. That also took place. I don't believe there were many close contacts, just a couple, and I don't believe there have been any other cases in that facility. From a prevention point of view in abattoirs, I know that WorkSafe and our third-party auditors from the Commonwealth have gone through a really extensive process of review to try and minimise the risk in those settings, because we know that they can have really, really extensive outbreaks. Up to 2,000 people have been infected in some outbreaks internationally. So everyone needs to keep on it in terms of managing the risk there. But in terms of responding to that initial case, we get a notification when the laboratory sends through that notification, or when a medical practitioner calls it through on our hotline. And a patient, a case, might be notified earlier. They might get an automated SMS text days before the department gets notified. We obviously follow up as soon as we're notified, but we're not always notified at the same time as a case might be.
That CEO says he took the initiative and shut down that abattoir, but DHHS has said that wasn't necessary because there was only one person infected. As you said, we've got JBS abattoir with 21 cases, we have Cedar Meats with 111.
Yeah.
Is it clear that this boss is taking the initiative when DHHS isn't?
No, I don't think so. I mean, there were no further cases. I think the risk assessment was made. It was probably appropriate. It sounds as if the risk and the close contacts and the particular circumstances of exposure in that setting meant that there wasn't a risk of more widespread transmission.
In terms of the links to the Melbourne, the Western Sydney cases, can you go into a little bit more detail about what those links are?
No, I think that's a question for New South Wales. I don't know what they've looked into. They will do all of the same interviews, working out the epidemiological links for those Western Sydney cases and what they trace back to, but they'll need to speak to it because they've done the interview and they've tried to make the epidemiological links.
We had a Premier said before there was 105 hospitalisations, which I think is quite a hike from 81 yesterday. So I'd be interested to hear your take on that. And also, at what point do we think about activating some of that surge ICU capacity that we have?
Yeah, so the increase in cases is not unexpected. This is what happens with 200-300 cases a day. I'm not surprised. We will see that many potentially ongoing as additional cases. That will be managed within the health system. We've had sufficient bed capacity, we've got sufficient ICU capacity, but in terms of the surge for ICU, that's all available and ready to be mobilised as required. And the ventilators number hundreds, over 1,500 ventilators. So the ability to mobilise more spaces where individuals can be ventilated is really much more significant. The number of people who are on ventilators at the moment is 22. We can go to 2,000 or more potentially.
Do you think it's time to reevaluate the suppression strategy, and is it even possible to eliminate the virus here?
Yeah, look, I've been asked about elimination. I'd love elimination. We're not at a point where it's the right time to make a detailed consideration of its feasibility, but it's worthy of consideration. There's no question that it's got its own challenges, but it's got its benefits as well.
What do you think the long-term plan is? I think a lot of Victorians are worried that we're just going to be thrown back into lockdown in another few months' time and we see another spike in cases. Is there a plan?
Look, it's a national plan. It's not a me plan or a Victoria plan. I think we need to have those ongoing discussions through AHPPC with the other Chief Health Officers and Chief Medical Officer, and for National Cabinet to look at how it's going across the country on a day-by-day basis as well.
Have hospital staffing levels been stretched at all by these recent outbreaks, and at what point might we need to call on that surge workforce database of other nurses and health specialists?
Look, it's probably for Andrew Wilson, the Chief Medical Officer in Victoria, to answer that, but my understanding is that the health staff who are furloughed makes it tricky, but it's all being managed within the existing workforce. There'll be some of those who've been quarantined now close to 2 weeks who'll be coming back online, but with new healthcare worker infections every day, there'll be a number of close contacts. I think all health services are very focused on the safety of their staff, and they're trying to minimise the potential number of medical close contacts that any healthcare worker would have, so that you don't get a huge number furloughed. The more that healthcare staff can make sure that they're keeping that distance themselves from other staff, not just in their face-to-face patient interactions, but with all other healthcare staff in all settings in hospitals, cafeteria, tea room, whatever the case may be, they will limit the need for furloughing of healthcare workers, which means there are more available. But at the moment, it's manageable.
Is it safe to have construction still going when you've got hundreds of people on the work site when everyone else is being told to work from home?
Look, there's work that cannot be done from home. Construction is pretty obviously one of them. I think we're emphasising all of the same things for every workplace in terms of trying to make it as safe as possible, keeping that distance. I wouldn't discourage mask use at all. Construction workers use them for dust protection and fume protection. They should be finding it pretty normal to consider a mask as well for COVID protection. So I think it's important work. It clearly can't be done other than at the coalface.
Just on aged care staff, you said yesterday that staff should try to minimise movement because we know a lot of them are casual workers and they live at more on site. The AMA is saying we should get a database of aged care workers who are fully trained now, like what we've got through the medical hospital system, to try to backfill some of those workers. What are the plans in place for aged care and managing that critical issue?
Well, I know the Victorian Department of Health is having conversations with Minister Colbeck's office and with the Department of Aged Care federally around those issues. They're not necessarily easy to manage. There has certainly been mapping done, but the workforce is the Commonwealth's workforce for private and not-for-profit aged care. So it's really for their consideration around reflecting on all of the challenges that Victoria is facing with outbreaks at the moment.
Would you agree there needs to be something significant shift in that setting?
I think to the extent possible, we would like to see both patient-resident cohorting and the minimisation of movement of staff between aged care facilities for sure, because that will minimise the risk of spread to other vulnerable settings.
And what about palliative care? How do you deal with that? I know some facilities are basically barring entry, which is obviously going to be difficult for a lot of families with relatives in the final stages of their lives. How should they be dealing with that?
Yeah, palliative care was always an exemption for visiting, and I think it's a very reasonable one. End-of-life care is a very important time for family members to be able to see their loved ones. The risk has to be managed. That's a call to be made for the particular health services or aged care services if palliation's happening there. But it's clearly one of those things where we, as HPPC, understood it to be a very important time to have that interaction with family.
Have we had any outbreaks in apartment buildings, and where do apartment buildings sit in the kind of spectrum of risk for spreading the virus?
Certainly we're getting household outbreaks, I'm sure in apartment buildings as well. I wouldn't have the details of the particular settings, but they are households where they'll be at risk depending on the workforce within that household and how many interactions they have to have.
I mean, like between apartments in a building, so say there's 50 floors, kind of people using stairwells, elevators, like is that a risk? Is that
I think it's always a risk to be in relative close proximity where other cases might be occurring. We shouldn't overemphasise how much surfaces can transmit. The virus can survive for a number of hours, but it's almost overemphasised in the sense that people don't understand that 1.5 metre distance is the most critical thing you can do. People can obsess about lift buttons. I think it's important to bear in mind all of the hand hygiene that we're emphasising, but it is that limitation of interaction with other people that will be the primary thing to minimise the risk of transmission.
Premier, on shared spaces, we're hearing that not every floor in 33 Alfred Street has got hand sanitizer on yet. That's common. Why is that?
I'm not sure about that report. That's not a report that's been drawn to my attention. I think it's important to acknowledge that people should be and are in their own apartments. So the need for some of those treatments or some of those products in shared areas is obviously much less than it would otherwise be. I'm happy to follow it up. People are in their own apartments. There's no reason to be outside your apartment other than to get medical care, which of course you'd be accompanied by suitably qualified people, and to get daily exercise, where again there's an appropriate supervision arrangement there.
And yet Greg Hunt has pledged that no health worker will die during the pandemic as a result of COVID-19. Do you back that?
I haven't heard Minister Hunt make those comments.
Do you back the idea that no health worker will die?
Well, I don't know that. Well, I would back the idea, Alex, that no one should die, regardless of what they do for a living. And that's why we're all working as hard as we possibly can to get the testing numbers up and to keep them up, to follow the rules, to provide care and support to those who are gravely ill, to make very difficult decisions that have significant consequences but are all about a clear strategy to bring control to these numbers, stability, and then drive them back down. Whether they're driven down to low single digits or zero, that's in the hands of every single Victorian. Whether these restrictions are in for longer than they otherwise would be, whether there are new rules that have to be imposed, and whether people in really significant numbers die, that is in the hands of every single Victorian. That's how serious this is.
Is it unhelpful for you to have the likes of Matt Canavan on national television this morning calling this a damn-made disaster?
I think that I've got bigger and better things to worry about than what a senator from Queensland says. I haven't seen the comments because I'm not watching that program. Frankly, I haven't got time. I'm working every moment that I can summon to get this job done. And commentary like that is of absolute no consequence to me. It is irrelevant. And I think in just the exchange we've just had, we've given that person and those comments probably more airtime than they need.
Just back on the
infringements
search
that were
capacity.
just mentioned.
Sorry, Laurel?
Some of the infringements that were
Yes.
brought up before. I'm making an assumption here that most of those people officially engaged in parties were probably young people. Why is our message,
I think that's fair, yeah.
Why is our message not getting through to young people?
Well, look, you never get 100% compliance with anything. There's always a challenge. You've always got to make sure that you're out there enforcing the rules and making sure that people who, for whatever reason, and there'll be a multitude of reasons, and it's really difficult to speculate on what the motives of some people are, but it'd be great if we could put a set of rules in place and we didn't have to enforce them because everyone was just motivated by common good, common sense, common decency to do the right thing. There will always be a small number of people who don't. I wouldn't want that really appalling behaviour, which we've caught and fines have been issued, I wouldn't want that to detract from the fact that the vast majority of Victorians are doing an amazing job, and I'm deeply grateful to them. They've got to keep going. We all have to keep going, and Victoria Police have got a job to do to make sure that anyone who's not following the rules, they get caught, they get fined, and hopefully that is a really significant way in which we can change the behaviours that they're exhibiting.
Have you thought about boosting or increasing the penalties because this is still happening?
I think that the penalties are very, very significant when you think about it. Businesses, 10,000, individuals, 1,652. There are opportunities beyond that if a really serious breach or multiple breaches, for instance, these matters can go to court where those fines do increase substantially. Look, if Victoria Police came to me and said we want different penalties because we think it'll assist in our work, then of course we would look at that, but that's not a request that's come forward, Richard.
And just back on our surge capacity,
Sure.
we had $1.3 billion committed in April to boost what was then 476 ICU beds by 4,000. Where are we at with those 4,000?
I don't think we'll need 4,000 of those, but there is substantial, that's the advice I've got, Rachel, there's substantial additional capacity. I think the Chief Health Officer just went to a number of about 1,500 and then potentially more than that. Not every patient will need exactly the same thing. There'll be, if you like, degrees of intensive care. So there's one-on-one patients that need a machine to help them breathe. There's then high dependency patients who need perhaps a little less care. They still need lots of care, but less care than someone who is being supported via one of those 1,500 plus machines that we've got sitting waiting to be deployed. I think it's important to think about treatment spaces rather than beds. If you get to the point where you need that sort of surge capacity, people won't be too worried about whether it's in a dedicated ICU ward or whether other spaces in the hospital are converted into an ICU ward. Those hospitalisation numbers at 105 are of concern to us, as Brett indicated, not a great surprise. The only pleasing thing there is obviously those numbers are up, but the ICU numbers are relatively stable. But again, everyone needs to do the right thing, play their part. Thank you to those who are. On every single metric, how much virus there is, how much it spreads, how long restrictions are in, the nature of those restrictions, how many people have to go to hospital, how many people are in intensive care, and how many people ultimately die. That is all the product of how hard we all work and the contribution that we make. Come forward, get tested, even if you've got mild symptoms. If you've got those mild symptoms, don't go to work. Don't visit family. You shouldn't be visiting family anyway. Don't go out shopping. To people who don't have symptoms, go shopping for the things you need when you need them. Stay at home means just that, stay at home. It's frustrating, it's challenging, I know that, but it will work if we all sign up to it, if we all embrace that COVID normal, as challenging as that is. It will be successful in bringing stability to these numbers and then driving them down. And that'll mean restrictions can be eased rather than us having to extend the 6-week period or having to put additional rules in place because the ones we have now didn't have the take-up and the buy-in and the collective effort that is central to making them work.
We've got more ADF arriving this afternoon.
Sorry, London?
More ADF arriving this
Correct.
afternoon. What are their initial tasks going to be? I know you outlined broadly what...
It'll be, well, it depends exactly who arrives, and there'll be, I think it'll be fair to say there'll be arrivals each day for the foreseeable future. It does take some time to go from about 335 staff to about 1,000 more than that. There'll be leadership as well as other senior people that are performing, I think, specialist tasks in the main. So it'll be off that list I went through yesterday and the statement that the PM and I put out. They'll just progressively, day after day, week after week, tick off all of those, and then we'll have, sooner rather than later, but again, it does take some time to stand up a contingent as big as that, but their skills are well understood, the task at hand is well known, and we're applying the best skills to our best efforts right across the board. It's principally providing specialist support where ADF have got those skills. So tasking, making sure that we're making the best use of everybody in the team, and then some specialist roles that I mentioned yesterday, the working alongside Ambulance Victoria, taking over some testing sites, some of those big testing sites, continuing to support Victoria Police in that hard border between Metro Melbourne, Mitchell Shire and regional Victoria, all of those things that we went through yesterday. But I think the arrival of additional support will be a feature of many days to come, because it does take some time to get 1,000 more on the ground.
Just on the state potential for tougher restrictions, how seriously that was considered and developed, and what sort of notice would the public get? There's been a bit around people panicking that it's going to happen tonight, etc. Well,
nothing that we said yesterday should have been. I don't think we certainly didn't.
That's not something you said. Sorry,
Sure. What I'd say is that we'll follow advice. We're in this lockdown now because the advice to me was there was simply no choice. If we didn't do this, far from pulling it up, we would see not hundreds of cases a day but thousands. Nobody wants to get to that place. I think all the way through, Rich, we've always tried to give people some notice. We've tried not to have, unless it's been absolutely critical, and again on the basis of the very best medical advice. For instance, the lockdown of those 9 towers was, the clear advice to me was you've got to do it, and you've got to do it right now. If you provide a lengthy notice period, then the strategy of trying to contain this simply won't work. The likelihood of further restrictions and the length of the current restrictions is in the hands of every single Victorian. Thank you to those who are doing the right thing. To those who aren't, they are selfish choices. You will be caught. Not only is it the wrong thing to do, it's just not smart. It's just not smart. You will get caught. Victoria Police are out there and they're doing a fine job at working with the community, providing information and support, but also making sure that these rules are followed.
If you're asking us to go to stage 4, how confident argue that it'll work, given that we've had so much transmission between essential workers who are probably going to have to keep going to work anyway, and family groups who were breaking rules that were in place.
Well, look, Rachel, I'm not foreshadowing stage 4. I'm simply speaking as plainly as I can. If people don't follow the rules, then additional restrictions become more likely. So whether you are motivated by someone in your own health, someone in your family, someone in your community, whether you're motivated by those sorts of things, whether you're motivated by the sense that we're all in this together, or whether you're motivated by wanting to get out of lockdown as fast as you can, do the right thing. That's the really simple message. Again, thank you to those who are. That is the vast majority. But there are some people who continue not to take this perhaps as serious as they should. And I just say to them, please change, please do better, and please know that Victoria Police are out there.
In terms of the financial assistance, you've obviously
Yep.
announced stuff for small businesses. Is there more coming?
We have. Well, there's.
Especially for landlords and ratepayers?
There have been 2 announcements, or sorry, more than that, but 2 packages of support, the last of which was in the order of about 550 million. We certainly don't rule out providing further support to those who are most affected by this. Then, of course, there's our health response, our emergency services response. There's a very big price tag involved in this global pandemic, not just here, but in every state, in every country around the world. I certainly could not rule out doing more. We have a budget later in the year which will be focused on jobs. It'll be focused on trying to repair some of the damage that this pandemic, this virus has done to us, and the fact that it's not going to be over anytime soon. It's going to be with us in one way or another, where there'll be some rules. It will not be normal. It'll be a COVID normal for many months, and indeed longer than that, even with the most optimistic projections around development of a global vaccine. You've then got to produce that vaccine. You've got to get it all around the world. You have to administer it. That in itself is a very lengthy process, and we still yet don't have one of those. Treatment may be the other option. I know that TGA's just had another drug that they've listed. There's a lot of people around the world that are doing lots of research, lots of trials, lots of hard work to get a better treatment as well, but none of us can predict when or if that will happen. So this is with us for a long time. That's why we all have to acknowledge that it is not going to end soon. It'll end, or we will get to a better place, a less frustrating, a less impactful, less damaging place if people follow the rules now. And again, thank you to those who are, but to those who aren't, please, for whatever reason motivates you, or simply just the fact you'll get caught, please change your behaviour.
So is there no planned announcements before the 23rd when the federal government is going to announce?
So I missed the first bit of your question,
there's
Alex.
no further planned announcements in terms of financial assistance from the state government?
Well, we made announcements last week, so they were pretty.
But I'm just saying, from now to the 23rd, you've got no planned financial assistance announcements coming up. We're waiting for the federal government now.
Well, the federal government has indicated to us, as they have to you and to everybody, that there'll be an economic statement on the 23rd. We've had substantial discussions, and we continue to be in discussions with the Commonwealth Government, and we're confident that when it comes to job seeker, job keeper, and other policy settings that they have in place, hardship is going to continue to drive them, and therefore, where the greatest hardship is, the greatest support will be. And I think that's a real comfort to everybody. But we have to wait and see. That they're obviously they're not our government. They are a different government. We work very closely with them, and it's their. They're perfectly entitled to make their own announcements. The 23rd, I think, will be a very important day for all of us.
I mean, just on restrictions, if we do increase restrictions, is it
Yep.
likely that we would go statewide for level 3 and then go to stage 4, or how is it likely to work?
Well, again, it will all be based on where the virus is, how it's being transmitted, those patterns of transmission. So the science of this will basically drive us, as it always has. So it's really difficult to foreshadow what further steps might look like, except to say this is largely in the hands of every single Victorian. If we all work together and acknowledge that it's us that are on the front line, every individual, every family. If you follow the rules, let's not have a situation where we just rely upon the last line of defence, our nurses and doctors in intensive care units. Let's all play our part. Thank you to those who are. Those who aren't, please change your behaviour. That's the smart thing to do. It's also the right thing to do. Whatever next steps, if there is a need to take them, we'll give people as much notice as we can. They'll be based on advice, they always have been, and that's why testing is so important. The more testing we have, the greater understanding we have about where this virus is, chains of transmission, the kind of epidemiological patterns of this. They're all facts, and that helps you then to make some very difficult choices.
Are you comfortable with the numbers in regional Victoria?
Had a long conversation with Brett last night and others, that sort of statewide overview, so looking at where new cases are. We're comfortable with the settings that are there now, but I do again make the point, these things can change rapidly, and whilst there are not the same stay-at-home restrictions in regional Victoria, can I just appeal to regional Victorians, there are still rules, so rules about gatherings, the rules about hand hygiene, about cough etiquette, about keeping your distance where you can, all of those things are just as important in a community with one case or even no cases as they are in some parts of Melbourne where there are many more cases than that.
Just on the abattoir, I know Professor Sutton was asked about
Sure.
it, but how concerned are you about the apparent lack of communication between the HHS?
Well, there's nothing apparent about that. I think the Chief Health Officer is just taking you through exactly what happened. And I'm sorry that the Chairman of the company feels that way, but the Chief Health Officer, who has just indicated to you exactly what happened and the judgments that were made. So I don't think it's apparent that that's happened at all. I think the facts speak and tell a very different story. Everyone's doing their very best. Everyone is doing their very best. It's a big team. It gets bigger by the day. Every single Victorian has a part to play. But the facts of these matters have been clearly outlined by the Chief Health Officer, no less. And I think that's probably the end of it.
Can you give Victorians any assurances that lessons have been learned from the Cedar Meads outbreak?
Well, again, every outbreak's unique, every case is unique, and the best possible response is applied to every single set of circumstances. No two businesses are the same, no two families are the same. That's why there's a long, detailed interview. That's why there's very specific advice provided based on the nature of a business, based on the nature of the number of cases, close contacts. I think this example, there was one positive, there were two close contacts. They were contacted within hours of the department being advised by the laboratory that there had been a positive case. Again, I'm just repeating what Professor Sutton has just indicated. That's the person who is in charge of our public health response, and I think that example and thousands of others show a team that is big, that is working extremely hard, a team that's doing its absolute best, and that's the assurance that every Victorian should be able to rely upon, and that's exactly as it should be. They're not seeking anyone's praise, they're just getting on with it and doing it, and I'm very proud of them. There's a lot of them, and they're doing their very, very best.
You mentioned yesterday, Premier, the private sector workers getting recruited.
Yes.
For contact tracing and stuff. When might they actually be helping out with teams? And do you have a goal how big you want that contact
So
tracing team?
yeah, sure. We've got we'll have further announcements to make once those arrangements are confirmed, and then we'll be able to give you some numbers. But it'll be call making, call taking, a whole lot of different tasks. Those people come with a skill set. Obviously, they're working in call centres. They're often dealing with very complex issues. Some of them have got some experience in terms of the health field. Doesn't mean they've got clinical qualifications or anything like that, but they're certainly familiar with dealing with some of the issues that are to hand here. We already have a number of stood-down workers, particularly from the travel industry. They've been working with us for months now because, again, they had those call centre skills and they're with very few flights and very little tourism. They needed a job. They were stood up for us after having been stood down by their employer, I think even before the JobKeeper arrangements came into place. I could try and come back to you with a number. But I think we'll see, I think you could see as many as 300, 400, 500 people across the private sector. That's dependent upon some of the individual discussions we're having with them. But the list we gave you yesterday, I don't think there's anyone to be added to that list at this stage. The other point I'd make, though, the banks, that's more of a kind of forward play. So we're going to try and train them now preemptively in the event that we need them. We, of course, hope we don't. But whether it's managing fatigue or dealing with growing case numbers or waves as they present over the life of this thing, the more people we've got trained sitting off to one side ready to help out, obviously the better.
Just on the potential for a hard lockdown.
Yes.
A lot of businesses want a harder lockdown now, and they want an elimination strategy, just so we're not seesawing in and out of these lockdowns.
Sure.
Is that something that's been considered?
Well, the National Cabinet decision is not to drive this down to 0 cases for weeks and weeks and weeks at a time, and that's the only way you could be confident that you had basically driven, that you'd ultimately beaten it, like the ultimate success. The decision that there's a massive economic cost that comes with that. I suppose what we're in at the moment is an exercise in testing the notion of how challenging is it to actually suppress and to regain some sense of control. There are many other countries around the world that have had second waves, and indeed waves beyond that. We're focused on our challenge right now, and if Victorians continue to do the right thing, come forward, get tested, they take these restrictions seriously and understand that they're there for no other reason than there's no other option. This is our only option at this stage. If you want those rules to come off quicker, if you want to get past this quicker, if you want to avoid a fine, then if you want to save lives, whatever motivates you, that's not necessarily the biggest issue. The biggest issue is people moderating their behaviour, changing their conduct, following the rules, being part of this, and acknowledging that we are all in this together. The scientific name, if you like, the public health label we put on it is less of an issue. It's stability, driving down these numbers and getting them back into a place where they can be controlled for the longer term. There'll be lots of papers in the Lancet and all sorts of other medical journals that will talk about all these things for a long time. What we're focused on is doing the practical stuff, the on-the-ground stuff that pulls this thing up.
Can we control it if we get down to small numbers, though? We got down to small numbers escaped hotel quarantine. Now we're dealing with, 1,900 active cases.
Well, and one night at a pub in New South Wales is thousands and thousands of people having to be telephoned. Like, it's wildly infectious. We've all made that point a number of times. It's very, very challenging. Very, very challenging.
Do you think there's a lesson, though, that we're now back in a second lockdown, that this doesn't work, that we will inevitably go into a third lockdown and fourth lockdown down the track?
I wouldn't say that that's inevitable. I think that we all have an opportunity to help shape what our response to this virus will be once these 6 weeks are over. If we all work together, then we can drive those numbers down to very, very low levels. And then that's obviously, just logic tells you, if you're chasing ones and twos, that's 3, 4 cases, that's much easier than if you're having to deal with widespread community transmission.
Well, as you say, it's wildly infectious.
It is.
How can you control it, even if it is low numbers?
Well, again, I can't change the way the virus presents. We've got to be clear about it. It's a wicked enemy. It's a very cunning enemy in some ways. The fact that you can have it, you can be infectious, but not know about it. You could be the most conscientious Victorian ever and get tested when you get symptoms, even the mildest of symptoms, and you could still have been moving around, even following the rules. You could have been moving around and potentially infecting other people. That's the enemy that we're up against.
What's your long-term goal? Where do you see Victoria at the end of the year?
Well, we want to get to a situation where we have as few rules in place as possible, but we have the rules that are necessary in place, and we have a very high degree of take-up, a very high degree of acceptance across the community that, whether we like it or not, this is not going anywhere. It is with us for a while. So there'll always be a COVID normal that we have to find, not just because we want it to be over, pretending that it is. It clearly isn't. And you look at Israel overnight, they had something like 1,000 cases a day. They've just gone back into a hard lockdown. About the same number of people in Israel, much smaller from a geographic point of view. But look, Singapore, Japan, the list goes on and on and on right throughout Europe. Too many states in the United States to list, where they're seeing, just as we are, the consequences of the fact that this is wildly infectious. Even one person can drive the sorts of challenges that we now face. All of us have to acknowledge that just because we want it to be over, it won't be. No one wants this to be over more than me. We want this done. We want to be back to a situation where we can start to open up. When I say me, on behalf of the thousands of people who are working with me and others, they are doing a great job. I'm very proud of them. They're doing their best. Let's all work together with them. Let's support them in the work that they're doing day and night by playing our part. following the rules, getting tested if you're sick.
Are any of our ICU patients healthcare workers or police?
I don't have that information.
Dr. Sutton, you...
We can come back to you. Have we learned from where we are now that the idea of local lockdowns by postcodes doesn't work?
I wouldn't say that, and I wouldn't rule out that having different settings in different parts of the city or the state for that matter, we wouldn't rule that out. That's AHPPC endorsed, that's National Cabinet endorsed. Who knows, that might be something that gets deployed in other states. If they've got a really localised problem, that'll be a matter for them.
Can I just ask a quick question?
Sure. Nothing else for me? Very good.
Sorry to be a bit dramatic before everyone, but I'm fine.
What do you make of the new report on speed cameras, which has found that 20% of them turned off at any given time and some have been off for more than 2 years?
Yeah, so this was something that I tasked Stephen Lean to have a look at in my first letter to him when I appointed him to that role. This was of concern to me, particularly, I get the quarterly reports on those fixed cameras, and we continue to have some areas where those cameras were off, in my view, for way too long. The figures in Stephen's report, about half of them equate to the WannaCry virus, so when that occurred. There are some times when things need to be down for maintenance, but there are also times when those cameras are off for way too long. Those cameras are there to save lives, and I want to make sure that we're using them in the best possible way as often as we can. And that report is very valuable to us. Some of the changes have been made, and it's exactly what I wanted him to come back and give us a pathway to fix this.
What went wrong as far as what's the biggest issue?
Look, I think the biggest issue is the issue of roadworks. So what happens is roadworks happen and they get turned off, rightly. It's very difficult. Often things are moving, the roads are moving. One of the recommendations is that we use a lot more of the mobile speed cameras during that time. We do want people to follow the rules, whether you're in a roadwork area or not, and I think that's a valuable piece of a recommendation that's been accepted by Vic Roads and will be implemented as part of that. And the other is just not allowing, a system where they just don't get turned back on after they've been off for a while during road work. So that's an audit system. I've already made significant changes to the team that manage the camera arrangements in Victoria, and they're putting in place these recommendations and other changes that we need to make sure we have the most robust system. As I say to Victorians, this is not about revenue raising. We know these cameras save lives. We know that they work. We know if people think they're going to get caught, they will change their behaviour. So we need them operating as best as possible, and I thank Stephen for his report.
So when you say changes have been made to the team, does that mean heads have rolled over this?
Yeah, there were changes that were made as a result of some of when the WannaCry virus occurred. It became clear to me that we didn't have the right people doing the jobs, and those changes were made at the time in the leadership in there, how it was managed within the department, and we also made changes to the powers of the Road Safety Camera Commissioner to make it more independent and to ensure that they could get the information that they needed. All of that has now culminated in this report as hopefully one of the really critical next stages of changes we need to make.
When were you first made aware of the issue?
I started seeing this on, I'd go through the quarterly reports. I had some conversations with John Voyage about it, but we had the WannaCry virus, that was his. So it was really during that time I noticed how often those cameras were down. So it was almost it was my first letter to Stephen Lean when he was appointed last year, said this is your number one priority. And he's taken that seriously and reported back very quickly. As he's been doing the report, we've also seen the department make some of those changes that was needed.
There are suggestions that one of the problems was that half of the list just got lost and was never fixed in terms of the cameras being fixed. Do you think that there's cultural issues within the department where they brush problems under the carpet?
I think there was absolutely cultural issues in the department, in the road camera safety system, no question, and that's why I made significant changes to that. They've been in place since post the last election. They're making a big difference both in terms of accountability, reporting, implementation of recommendations, as well as the relationship with the Road Safety Camera Commissioner. I feel much more confident, but this is an area that I'm continuing to task the Road Safety Camera Commissioner with tasks to make sure we have the most robust and transparent system we can.
In terms of domestic violence, there's obviously rises in cases at emergency departments as well as police call-outs. Are we changing the response at all now that we're in the second wave, or are we?
Well, right across the board, police have been increasing their resources, whether it's Sentinel, whether it's the PSO, but also importantly Operation Ribbon, which they put in place, that continues to operate. So this is where they're reaching out to people. Again, because we're now back in lockdown, that's been put back into place in a significant way to make sure we're checking on those victims and perpetrators that are known to the system to try and reduce harm. It's been a really important part of the police response. It's saved lives, no question in my mind, in terms of family violence victims, and that will continue to operate throughout this lockdown period.
Police have just arrested a man in relation to the death in Mill Park who appears to be a contact of the lady. How many, have you been alerted to more deaths as a result of domestic violence during COVID?
We have women die at the hands of partners every day across Australia. This is, it's why we had a Royal Commission into Family Violence, why we funded more police, specialist family violence police. Like, this is our biggest law and order issue, which I say every crime stats, it is our biggest law and order issue. It continues to occur, not just in COVID times, in all times across Victoria, across Australia. We have to take it seriously. Victoria Police takes it seriously, but as a community, we have to change attitudes, and that's why it's not just a police response. It's a government, a community response that's required to change that.